CEO and co-founder of GlucosAlarm, and we are closing the gap on diabetes. Imagine that you're driving to work, and when you get there, you get off your car and you pass out. Well, this happened to one of our friends. He's actually a doctor, and he had been diagnosed with diabetes for over 10 years. But that morning, he did not check his sugar levels. And it turns out that he's not alone, because we live in a diabetic world where there are almost 400 million diabetics. And this number is estimated to grow to almost 600 million in the next 20 years. If diabetics were to make up a country, it would be the third largest country in the world, only after China and India. And it would be a very expensive country too, because 1 in every $9 spent on healthcare globally goes to diabetes. The American Diabetes Association recommends testing twice a day, but only 5% of those patients treated with oral medication, diet, and exercise are testing as recommended. And the problem with this is that complications can be as severe as blindness, amputation, and even death. Currently, there are 2 testing solutions. They're equally effective, blood and urine. But on one hand, blood is complicated, is painful, and is expensive. And on the other hand, urine, which is less expensive, is complicated, is messy, and is not very precise. But today, I am thrilled to tell you that with the advancement of microchip technology, we have been able to solve these problems. Introducing GlucosAlarm. GlucosAlarm is a device that is placed inside the toilet and is so easy to use, it causes no disruption to daily life activities. It's precise, it's painless, affordable, and it offers a connected solution so that patients can share this information with their relatives or healthcare providers if necessary. So we took a look at our competitors, and we noticed while some of them are precise, they require painful procedures. Others are way too expensive. And in the case of urine strips, you lose that precision. But with GlucosAlarm, we have brought urine testing, which has been used for decades, and we have paired with microchip technology to make it a painless, precise, and app-enabled device. We are a Class 2 device, and we will follow the 510(k) path towards regulatory. And we have found our predicate devices for our enzyme intended use and our technology. Also, our device is covered under Medicare code for the device and 2 other CPT codes for telemedicine. So we also ask the question, who can we help the most with our technology? Senior care facilities are the perfect fit for our device because patients are there all day being monitored by a nurse, and nurses are able to get real-time data from their patient's last reading, helping them to monitor the disease and also prevent unnecessary trips to the emergency room. During the first year, we will be targeting 20 facilities per year on an average of 100 beds per facility. With this, we will bring in $500,000 in revenue in the first year from selling the device and the refills. But on the 3rd year, we will begin using our connected capabilities to start performing telemedicine with the devices that were installed during year 1 and 2. With this, we will be able to collect enough information to prove that our device does in fact improve patient compliance and also avoids unnecessary trips to the emergency room. With this, we will be able to enter the over-the-counter and prescription market, which in the US alone is valued at almost $9 billion a year. Yes, B for billions. The team that will make this happen, I have previous experience with 2 other startups. Carlos has more than 7 years of experience in wireless sensor network development, and both of our rock star mentors, True and Cameron Brackett, bring almost 50 years of experience in medical device research and development, and combined have filed 140 patents. Also off the slide, our team member Leticia Guerra, who took care of my 1-month-old when I came to the program. So far, we've done a lot of fun things during the summer. We have been able to file patents in Mexico and in the US with extended functionalities and measurements such as triglycerides and cholesterol. We also have been able to validate our core technology. And also, we were named one of the top 10 innovators under 35 years old in Mexico by MIT Technology Review. But wait, I got more. We were invited to go compete in the Global Innovation Through Science and Technology, sponsored by the Department of State and the American Association for Advancement of Science. And we went all the way to Nairobi, Kenya to bring back home to Memphis the first place. With additional funding, $25,000. With $1.1 million, we will be able to have a beta prototype ready for 510K submission and have a product ready to launch by January 2017. During the course of this 5-minute presentation, more than 2,000 people have died from diabetes. It is time we start doing something about it. We are GlucosAlarm, and we're closing the gap on diabetes. Thank you.